Okay. Siobhan, welcome back.
Thank you. Siobhan Katari, Department of Health Services. And I have Dr. Kassirier on the line with me today to answer questions. So today we are, first of all, wanting to report just great news that our COVID case rates are coming way down. As per the report that was published, they were at just over 10 per 100,000 case rate. And as of this afternoon, they're at 7.1 per 100,000. So very good news. We're going in the right direction. We're also seeing a decrease in our deaths and our hospitalization numbers. So very good news overall about that. Today we're going to not focus on data as much as we're going to focus on some of the information that's coming out from the state in terms of mandates and in terms of the state's California Smarter Plan and what that means in terms of next steps for the pandemic. So first of all, before I jump into the PowerPoint presentation, in your COVID update, we did put that there were some updated state health officer orders that I wanted to lift up. Effective February 28th, the general masking requirements for unvaccinated individuals moved to a strong recommendation for all persons regardless of vaccine status. So no more mandate, but strong recommendation. Masks, however, will still be required for everyone in high transmission settings like public transit, emergency shelters, healthcare settings, correctional facilities, homeless shelters, and long-term care facilities. So other public settings outside of that are not included in a mask mandate anymore, just a strong recommendation. Also effective the end of the day, March 11th, universal masking requirements in K through 12 and child care settings will also move from a mandate to a strong recommendation. School districts may choose to continue to require masks after this date. However, there will be no statewide or local mandate requiring them. Masks continue to be required in all public and private K through 12 schools and child care settings through March 11th. And Sacramento County Public Health is not implementing any local requirements, and we are aligned with CDPH's strong recommendations cited here. So now I just wanted to see if there was any questions about the mask mandate before I move into the California Smarter Plan.
Siobhan, just so you said through March 11th, so schools are required through, I guess, 12 o'clock midnight on Friday, but if they have events on Saturday, then they're if there are athletic events or other extracurricular activities, even if they have school events or in school activities, they're no longer required to.
That's accurate.
Okay.
Yeah. Thanks.
All right, thanks.
Okay. With regards to California Smarter, so this was Governor Newsom's plan for moving beyond the pandemic into what we call an endemic. So what will it look like as we start to kind of roll back some of these mitigation efforts that have been going on? So our collective work in California has resulted in a whole of government response that led the nation in providing resources to local and community partners. And these were just some of California's accomplishments. So it pertains to the state as a whole. Over 70 million COVID-19 vaccines were administered, 870 million N95 and surgical masks were distributed, 140 million tests were administered, 33 million at-home tests were distributed, 7,500 COVID-19 testing sites were established. Over 28,000 state-supported staff were deployed to over 800 healthcare facilities, and over 700 community-based organizations partnered with and supported these efforts. So this plan has multiple variables to it, and I just wanted to go over each of those. The first is shots. We know that vaccines continue to be the most powerful tool that we have against hospitalization and serious illness. We know that masks, properly worn masks with good filtration, help to slow the spread of COVID-19 and other respiratory viruses. We know that we need to continue to stay aware of how COVID-19 is spreading. There are evolving variants, and we need to communicate clearly how people should protect themselves and coordinate our state and local government response. We need to stand on the ready. COVID-19 isn't going away, and we need to be ready with the tools, resources, and supplies we'll need to quickly respond and keep public health and the healthcare system well prepared. With regards to testing, we need to get the right types of tests, PCR or antigen, to where they are needed most, and testing will help California minimize the spread of COVID-19. With regards to education, California will continue to work to keep schools open and children safely in classrooms for in-person instruction. And with regards to prescriptions, evolving and improving treatments will become increasingly available and critical as a tool to save lives. So in terms of some of the metrics to keep this preparedness, in terms of shots, California wants to maintain the capacity to administer at least 200,000 vaccines per day on top of existing pharmacy and provider infrastructure. We want to maintain a stockpile of 75 million high-quality masks that can be distributed as needed. We want to maintain the capability to promote vaccination, masking, and other mitigation measures in all 58 counties and support the engagement with at least 150 community-based organizations. We want to maintain wastewater surveillance in all regions and enhance respiratory surveillance and healthcare system while continuing to sequence at least 10% of the positive COVID-19 specimens, and have the ability to add 3,000 clinical staff within 2 to 3 weeks where the need arises across various healthcare facility types. With regards to testing, we want to maintain commercial and local public health capacity statewide to perform at least 500,000 tests per day, a combination of PCR and antigen. With regards to education, we want to expand by 25% school-based vaccination sites supported by the state to increase vaccination rates as eligibility expands and vaccination requirements are enacted. And then with regards to therapeutics, in order to maximize the most clinically effective therapeutics available through federal partnerships, we want to ensure that the allocations of effective therapeutics are ordered within 48 hours. I wanted to also add that, a question has been coming up about what are the metrics or the trigger points that would tell us that we need to turn on some of these preparedness activities. Like, when would we distribute masks, or when would we set up more vaccination sites? And there hasn't been any definitive answer on what those metrics would be. The CDC a couple of weeks ago did release a framework that they're calling the CDC COVID-19 community level, which kind of puts communities based on impacts to their hospital and healthcare system and surges into 3 levels, a high, medium, and low. California CDPH has not yet decided how it will interface with the CDC's system. And so we don't know exactly what those trigger points are, but I think the message that I want folks to take home here is that our ability just to maintain that awareness and ensure that we're watching the numbers and watching the settings where where we may see outbreaks or where we may see new COVID variants appear becomes increasingly important, so we can have those conversations at a local level or at a regional level about what needs to happen. And so I think as the state's talking about not really looking at it in terms of statewide mandates, but really where are these outbreaks happening? Where do we need to start looking? We don't think COVID's going to go away overnight. We know there's things that we can continue to do as a community to mitigate the impact, but we also don't feel the need to look at things at a statewide level at this point. So just wanted to lift that up. And then finally, this last slide just really talks about
Siobhan, I'm sorry, Supervisor Kennedy had a question.
Sorry. Thank you, Chair. The last slide, the one that says education expand 25% school-based vaccination sites. That's fantastic, I think. I know a lot of people don't agree with me, but what? I mean, it's state sites, but. Because actually this exact came up at a community meeting I had recently, in which, a couple of parents said, they took their kids to CVS and their kids were frightened, whereas at school they'd feel much more comfortable. So what's the time frame of that, do you think, if you know?
Yeah, I actually don't know the answer to time frame. Dr. Kassirier might, so I'll see if she wants to answer that.
Sure. Good afternoon, Supervisors. This is Dr. Olivia Kassirier, Public Health Officer. So your question pertaining to the testing at the school sites is being supported by the state. They have the capacity that any of the schools that have signed up for their program, they're able to support them with all of the necessary testing kits. With the staffing, the schools have had.
I'm sorry, Dr. Kassirier, if I could interrupt you. You're saying testing. This says vaccination sites.
Oh, okay.
Okay.
Sorry.
All right.
Well, both with the vaccinations and also with the testing. So sorry, I started off with the testing. So with the vaccinations, it's actually a combination.
Okay.
We do have two teams that our public health staff go out to some of the schools, but we also have resources from the state, and so the schools can put in requests to the state and then have teams go out to them. So we're doing that right now. What we don't know about is how long the state resources will be able to stay on. We know that for now it's through March, and we're waiting to see if they're going to be able to extend those contracts through June.
And it says expand by 25%. What's the baseline?
The baseline is what we have right now, but what they're saying is if there is a need to increase, that they're able to get additional staffing from contracts that they have with nursing agencies.
Okay, thank you.
Okay, thanks, Patrick.
Okay. And the last slide just shows the cumulative deaths attributed to COVID-19 reported to the CDC. So we just wanted to lift up that California is the orange line on here, and you'll see that California did fare better than most of the big states overall in terms of cumulative deaths due to some of the measures that were taken in California. So,
yeah. Supervisor Serna?
Thank you, Chair. So I find this chart fascinating, but what would be more fascinating, and perhaps you or Dr. Kassirier can shed some light on this, what would this look like if you overlaid vaccination rates?
Yeah, I mean, I'll let Dr. Kassirier answer that. Thanks.
We are working on the data for vaccination rates, and when you're looking at, I guess what you're asking is when you're looking at deaths overlaid with vaccination rates, is that?
That's what I'm asking, yes.
Yeah, so there is a different slide that shows that. I can definitely make sure that I provide that to you, but you do see that in general, states that do have higher vaccination rates did fare better.
Okay. Thank you.
Great. And then just finally, I wanted to report on the jail and let you know that we are down to having only 6 cases currently of COVID-19 in the jail. So that's really good news. We feel like we're just about out of what we were calling an outbreak before, and that's great news. Hopefully by next week we will be in the clear.
That's for both jails?
Yes, combined. So six in the main jail, 0 at RCCC. So, and with that, that ends my COVID report, and I'm happy to take any questions.
Siobhan, I know we've received correspondence certainly over time, but recently, in relates to the declaration of state of emergency, and obviously, our emergency orders have emanated from the state's emergency order as it relates certainly to the public health issues. Could you just elaborate on that and what your knowledge is of, again, how long you think, well, I guess the state's extended it now at least to suit in this month, maybe even beyond, but, and again, whether it's discretion at the local level, to your point about some of the statistics here, to at some juncture consider departing from what the state may be declaring, or because we've been aligned with the state all the way along, and maybe that's the sequence we will continue. I'm just curious because we've gotten some inquiries regarding that, so I don't know if you feel comfortable responding, but that's my question.
Sure, and I'll just ask Lisa if she wants to respond first, and then I can add.
Okay.
Sure, we can both respond to the question, but yes, the governor and the state have maintained their state of emergency, and yes, we have, and as most counties have, conform to that. There are specific advantages to the county in general by having our own local proclamation of emergency and public health emergency. It relates mostly to the fact that we have volunteers and workers, and the working on the public health crisis, and the emergency shields them from certain liabilities. So there are legal reasons why we are recommending keeping it in place. Additionally, as you all know, we've received and are continuing to request funding from FEMA in response to the emergency, specifically Project Room Key and other programs. FEMA is extending the deadline for reimbursement requests, and that's another reason why we recommend, from a legal perspective, to keep those proclamations in place for the time being. And again, the public health officer and emergency management, they are continually reviewing the need to do so, and we had a conversation earlier today, and those are the main reasons why we're recommending keeping those proclamations in place.
Okay, well, thanks for, again, I didn't realize you had conversations ongoing about that, but I appreciate the currency of what you just shared. So,
right. And I would also, can I just add one more thing? Yeah. I know Mary Jo sent the board something back in June, and we can recirculate that again, basically stating the reasons why it makes sense for us to continue those, even though the pandemic is, and the case rate and death rate and everything is coming down. There are other specific legal reasons why we'd want to do that.
So that was in June of 21? Yeah,
June of 21.
Okay, maybe you can resend that. I do recall the memo, though. Okay. So is there any dates, outside dates at this point in time? It's run concurrently with the state's extension of the deadline.
Right, and I think that, and correct me if I'm wrong, I believe they've said that it's going to be at least until June 30th of 2022. Is that correct?
Correct, June 30th.
And then at that point, I think that they are considering lifting it, but they haven't stated definitively if it would be.
Okay. No, I appreciate the response. Thank you.
Yep, nothing to add. Thanks.
Okay. Any other board member? Don't see any, so we have a couple of speakers. Did Dr. Kasiri have anything else, Siobhan?
Dr. Kasiri, anything to add?
No, thanks. I don't have anything this time.
Okay. All right. Thanks, Dr. Kasiri. Thanks, Siobhan. All right. We have two speakers, Gabrielle Ingram and Ryan Harris. So, Gabrielle. Good afternoon.
Apologies, they don't sit still very well, so I didn't want them in here. And thank you for getting the sound set up for me so I could actually hear you guys. So I actually came here today to ask what the metrics were to end the local emergency declaration. So I just heard the legal reasons, but I heard nothing about there being actual an emergency. So liability shield, funding, volunteers. That's not an emergency. That's reasons to perpetuate the emergency, but that's not the reason to go against government code to end an emergency at the earliest. Where's the actual thing? Government code 8558C to terminate given there's no local emergency. So, I mean, legal counsel weighed in, so I'm assuming that they've looked at that, but that's my concerns, is that we continue to perpetuate this. Case rates are down, death rates are down, viruses don't go away. This virus has animal reservoirs. It's never going to be eliminated. It will forever mutate, and we will have random outbreaks just like we do RSV, the common cold, the flu. I'm like, where are my children? I'm not saying COVID is like those. I'm just saying viruses don't go away. So June of 2021, we have the soundbite from when it was first announced that funding was a reason to keep it. We're almost, 6 months, 7 months from that. So we're in a good place. We may not be in the fall because in winter, everybody's vitamin D levels are lower. We're more susceptible to illnesses. So I am concerned that you're getting counsel to commit fraud. You all took an oath, and you're the only one that's liable for that oath, regardless of the advice sent to you. So if the state is perpetuating an emergency unconstitutionally, you guys following suit doesn't mean that you escape that liability. Never mind the fact that we need to, the amount of money coming through, our children are going to be paying for years. So I came here to ask those questions, and it was answered before I even walked in for public comment. So I'm a little scared about what I heard, and that's it. So thank you for your time.
Good. Thank you, Gabrielle. Okay. Then next, Mr. Harris, Ryan.
Hello.
Hi, Ryan.
Long time no see.
I want to reset the clock. Excuse me, just 1 second, Ryan.
All right.
Flo, could you reset the clock?
Yeah,
I can't get to reset.
I can't.
Okay, I couldn't get. There you go.
There you go.
Thank you. Okay, great. Go ahead, Ryan. Okay, Mr. Harris, go ahead.
Yeah, much time to prepare for this meeting. However, if it's about COVID, given the recent line of events with you guys, I hope that's going to be frequent, and I hope that we'll have a few more of them. Keeping that in mind, you guys, put the fear of death into people by letting them know how scary this COVID thing is. And then at the same time, you guys kind of turn around and act like it's no big deal when you need it to be no big deal for you guys. And it may be okay for you guys to understand why you do that, because you have a better understanding of what's going on than all of us that live here. But at the same time, when you do that so quickly and swiftly, it throws us all off guard out here. An example of that would be at the peak of our COVID season. I could get you exact dates if we do have future meetings on this, but at the peak of our COVID season, my program manager at the time, Carmel Sidney, was allowing potlucks to still take place within the department buildings. Now, I don't know about you, but trying to stay 6 feet away from people, along with not touching things and sharing things that other people may bring from their house, kind of goes against those procedures. When I brought this to their attention, I was ostracized for it. Then I was sent an email by my program manager so he could cover himself, I'm sure, saying that, no, this is not happening. So I went and took a picture of it. I could bring those pictures if need be, if you guys don't believe me. In addition to that, some of the statements that you guys were telling staff or department staff within the county were false statements. You guys were saying that no worries, we'll inform you if someone does have COVID. After that potluck, everyone in my row, excluding myself, but everyone in my row caught COVID. Again, I'm not saying it's the county's fault, but when you guys fail to protect your people, it looks really bad. Another thing I want to mention is that an example would be that, again, my program manager at that time, Carmel Sidney, assured me that the 6 feet and 15 minutes were the guidelines to CDC, as well as some other things. And again, I can bring you those emails and put them up here in future meetings if need be. What I'm getting at is that he had let me know, as I mentioned, everyone in my row, except for me, thank God, contracted COVID. And he had let me know that it didn't affect me because I wasn't working closer than 6 feet for 15 minutes. I was working closer than 6 feet for 8 hours a day. And again, I've shared some of those pictures with you in your emails. I don't know if you've gotten to them or not, because you guys don't really get back to me. I'll be playing your voicemail, Mr. Desmond, from last year when you said, I'll be calling you tomorrow. We're well past tomorrow, and I'm still waiting for that call back. So I'd appreciate that. But other than that, again, after I brought this to the attention of my program manager, I was actually sent home from work, put on paid admin leave for bringing that to the attention. However, what made it worth it was the people around me. I understand my time's out. I'll be ending shortly. Okay. What made it worth it was the people around me sending me emails saying that they were thankful that I said the things that they couldn't say. And if I no longer have my job, they may know why. So I'm not sure that could be a reason. Thank you.
Thank you, Ryan. Okay. We have any folks on the phone?
We have one caller in the queue, and they're going to transfer them over
Okay.
right now.
Thanks.
Hi, caller. Please start with your comments. You have 3 minutes.
Hi, yes. My comment is about the misinformation resolution from September 14th, 2021. And my comment is as follows. You want safety for everyone. I want safety for everyone as well. This resolution is intended for facts. The resolution states numerous studies support that mask wearing has no significant adverse health effects for mask wearers. None of the sources stated this. The sources that go with your resolution, I looked them up, and none of the sources state that. So the resolution is incorrect. I would ask the board to please fix that. That is misinformation. Also, I have emailed and asked for studies, and the studies that were sent to me personally by Dr. Kasiri, and I don't know where she got the studies from, but they don't state that masks are safe. I'm not questioning if masks work or not for COVID. I'm saying, are they safe for long-term use for society? The resolution states injections proven to be effective in reducing COVID-19 transmission. Your source doesn't support that statement. Again, please check your sources or correct this resolution. The source you provided stated, quote, infection in fully vaccinated people cannot be completely eliminated. At this time, there are limited data on vaccine effectiveness in people immunocompromised. Vaccine effectiveness against variants remains under investigation. Vaccines are in phase 3 of clinical trials. Also, for menstrual issues, the study just started not that long ago, and the resolution says that this has been disproven. So I would ask the board and Dr. Kasiri to please fix the resolution because you guys are lying. And I even checked it with your own sources. So either someone doesn't know how to do research or you guys are just okay with lies. And I'm tired of you guys misinforming the public. That's my comment. And my name is Blanca. Thank you.
Thank you, Blanca.
Okay, that concludes your public comments.
Okay. All right. Board members, any final questions or comments on this item? If not, then that'll conclude the report for today. Thank you to our speakers. And brings us down to our separate items. First, county executive comments. Ms. Edwards.
I don't have any comments today. Thank you.
Okay. Thanks, Ann. All right, board members. Any announcements? Any other comments? All right. With that, then, Madam Clerk, unless there's any other order of business, we're going to go adjourn for today, and we'll be back here March 22nd. We've got a full agenda that day, I believe. So, okay, very good.